Hi everyone, my name is Shaylee Mosier and I'm going to be talking about transitional care management in the clinic setting. Thank you for listening. The community that I am talking about, I live in Garden City, Kansas. This is one of the larger towns in southwest Kansas. The population is about 26,000. It's considered the melting pot of Kansas. It's a very diverse community of cultures. Our high school here at Garden City Community College, Garden City High School has over 28 languages that are spoke in that school alone. Very diverse community. We have a lot of people coming over here to work at the meatpacking plant, at Tyson and National Beef, and just all sorts of diversity and community cultures throughout the town. Therefore makes for a bunch of different types of people that we work with on a daily basis. Plaza Medical Center is the place that I am working at currently. It is one of the 3 family medicine clinics in town. 4 physicians and 2 nurse practitioners in our clinic. St. Catherine Hospital is the local hospital in Garden City. It does have an ER, med-surg units, OB, ICU, acute rehab, surgery, and pediatrics. This hospital is also that we are affiliated with them because we are owned by the same company, which is Centura Health out of Colorado. Plaza Medical Center consists of the front staff, nurses, physicians, CNAs, laboratory, radiology, and of course management. Outpatient family practice is the specialization in this clinic. We see anything from newborns to children to adults and also the elderly. We have one physician that also does OB care. Her name is Dr. Swati, and she's actually the doctor that I work for. She has been there for about 2 years, and a couple of the physicians have been there for several years. It opened in 1979. There's 26 clinic rooms. It was physician owned until 2018. It was then bought by Centura Health. Centura, like I said, also owns St. Catherine Hospital, so the hospital and Plaza are affiliated, so we're able to work really closely together, and that way we can work on this problem that I am getting ready to discuss, which is transitional care management, and able to implement the proper follow-up care for patients in the outpatient setting. Community culture. The mission of Centura Health Plaza Medical Center, we extend the healing ministry of Christ by caring for those who are ill and by nurturing the health of people in our community. The core values that we talk about almost on a weekly basis is compassion, integrity, stewardship, excellence, respect, spirituality, imagination. We use these values in everyday work that we do with our patients. These values are shown by all associates, whether it's the front staff, the nurses, the doctors. Everyone is very compassionate and works very respectfully with patients. We communicate with them and maintain their privacy, giving care to the utmost passion, like I said, that we can provide. Religious-based foundation through the Catholic Health Incentives Program. The facility relates to our diverse community where our multiple different cultures are. Like I said, there is so many different types of cultures that are in Garden City. So we do allow for practice of whatever these patients are wanting and respect what their culture is. The issue. The gap of transitional care management from hospitalization, so from acute care setting to the follow-up care with a primary care doctor. Patients are not following up appropriately with their PCP. A lot of it is due to misunderstanding of simply why is it important for me to follow up. I'm going to see my doctor eventually and we'll catch up then. It's very important to make sure that patients know that it is important to follow up with the primary care in the amount of time that was said when they were released from the acute care setting. to maintain their health in that transition from one place to the next. Another reason is like the patients do not actually have a PCP. A lot of times patients come into the ER and we joke around sometimes, but it is true that a lot of patients just use the ER as their primary care because they don't have an actual primary care doctor. They just simply go to the ER when they have something going on with them, and that's how they get fixed. No follow-up being done by the PCP office is another problem. We need to make sure that as an office, we do our best to follow up with our patients and call them, contact them, make sure that everything is okay, that they're okay, that they understand, their family understands what's going on, the new medications, things like that, treatments that need to be done. We got to make sure we follow up with them. Lack of insurance and the healthcare expense is a large reason why I hear most of my patients say that they don't want to come in for a follow-up appointment because they think it's pointless. And they also don't want to pay that extra money, which is understandable because healthcare is expensive. But we do have to try and reiterate to them why it's so important to come see us. In return, it causes patient readmission. Readmission rates are still high. In St. Catherine Hospital, the statistics have shown that like lack of understanding of discharge medications and how to properly take them, not following up with treatments such as like chemotherapy treatments in the outpatient setting, could be following up with a specialty doctor that they were referred to, like a nephrologist, a urologist, cardiologist. And not doing echoes and things like that. Misunderstanding of pathophysiology, like of the disease management itself. Patients just don't understand. Say they were diagnosed with diabetes, how they are to prick their finger and check their blood sugar and make sure and give themselves their insulin. A lot of times patients don't get that education that they need. So that is a big reason why we want them to come in and see us. The social impact, former leader for Plaza Medical Center is Dr. Brian Stuckey. We work closely with him and with quality management department at St. Catherine to make TCM easier for providers and patients. Transitional care management is important for patients and physicians to be on the same page after being discharged from the acute care setting. It can limit confusion and help prevent readmission. These are words from Dr. Brian after I talked with him about how he feels about TCM. He thinks it's a very important thing and we need to actually be implementing this as good as we can. In the acute care setting, the hospitalists and surgeons, any other doctor that has those patients under their care, they are starting to send discharge summaries to the PCP doctor because we are all on the same network. We're all on Epic. And so Dr. Julie King and Dr. Benjamin at our hospital are doing a really good job of sending the discharge notes to the PCP. Therefore, the PCP then tells his nurse or her nurse what's going on and that they need to contact the patient to get them scheduled for follow-up. Cutting down on the middleman, which is generally the patient. The patient is usually left with that responsibility to be calling and getting their follow-up appointment. That just does not normally happen. Patients just do not call. Tertiary prevention. This is preventing issues with the disease that is already diagnosed and we already know is going on. We want to prevent further problems. Analyzing the issue. The strengths of TCM are the ability to work closely with St. Catherine Hospital due to being owned by the same company. Plaza Medical is now on the same EMR, which, like I said, is Epic at St. Catherine, and so it's making it easier to access information like lab work that was done there, imaging, EKGs, anything like that. That way we can work together and we can all be on the same page, know exactly what medications are being given and stopped, and it's just very helpful to be on the same page with the hospital that we work with so closely. The nurses for each doctor is is a very big strength. Each doctor has their own nurse at Plaza, so able to monitor more closely and specifically based on knowing who their patients are and saying, hey, I seen that they were in the hospital. I do need to do that follow up. It's very nice to have each doctor having their own nurse so they can work together to take care of their patients. Weaknesses, I say basically the inability to know when patients are discharged from the hospital is the problem. Difficulty getting through to the clinic via the phone is a big issue. Our phones at Plaza, we don't have a lot of front staff, and it can be very hard to get through to the phone, honestly, is actually a weakness of our clinic, which we really need to work on. During the fall and winter months, patient load is higher because of flu, strep, pneumonia season. So it's harder to squeeze patients in for their follow-ups from the hospital, but it's so important, especially the elderly who are suffering from pneumonia and things like that. We need to make sure they're following up, taking their antibiotics appropriately so they don't end up being readmitted. Funding. This type of issue is dealt with the quality management department at St. Catherine. A team of nurses present the information to the board at the hospital, and then they decide how the funds can be dispersed in order to fix this. This topic has been brought up recently, and the board has decided that they really don't need a lot of extra funding for this because they already have Epic and they're able to run reports off of Epic, so we can each nurse is able to run that report and we can figure out what patients are being discharged, which is very helpful because we don't have to go searching for it. We just have to run a report. So that is really nice because they already have Epic. So it's just something we're implementing within Epic itself. The recommendations with transitional care management reporting, like I said, a report that's ran by each nurse or a doctor in the clinic, details regarding the discharge summary, releasing from the releasing doctor in the hospital and why they were discharged, where they were discharged to. Some patients end up going to the nursing home. We need to make sure we know what nursing home and that we're going to follow up with them appropriately, because most of the time when the patients are in the nursing home, they are under their PCP's care. So they are still being taken care of and the orders are being wrote by the primary care. So we got to make sure we work closely, especially with nursing home situations or skilled care units, assisted living homes, very important. But this report can help manage this so much easier. This is a report that they're working on doing at St. Catherine. We're working on getting everything together and getting these getting these reports done every morning. It's slow learning process and it's a slow process to start with, but it's starting to get there and I do see the benefit in it. And that's why I'm really pushing hard for the TCM reports to be done by each nurse for each doctor, even not just in our clinic, but the other clinics as well. TCM requirements for insurance reimbursement is follow up with a nurse call within 48 hours of discharge, which is business days. Follow up appointment with a provider is within 7 to 14 days, depending on the severity of the disease. It depends on how critical that patient was. Discussing the importance of follow-up with patients. I think I can also help talk to patients about TCM by posting these poster boards in my clinic rooms, even just papers on my pegboards in there, emphasizing the importance of care and like, hey, if you're in the hospital, give us a call when you're getting ready to leave and make sure that we get you the right things that you need and any care that you need coming out of the hospital, because we do want to take care of you. Maintaining good professional relationships and rapport with our patients, and that way they feel comfortable to call us and say, hey, I just got out of the hospital, I know I need to follow up, when can you see me next? I think that is super important, to be so professional and have good relationships with your patients. Essentially, this is my transitional care management issue, and this is how I think we can fix it. And these are my references. Thank you all for listening.